Hey, welcome back to Quiet Badge's Stories. I'm glad you're here. Before we get into today's story, if this is your first time visiting the channel, hit that subscribe button, because we put out new stories every week and you don't want to miss them. Drop a comment and tell me where you're listening from today. And if this story moves you, and I think it will, go ahead and give it a like. It helps more people find us. Alright, let's get into it. The chief of emergency medicine at Hargrove Regional Medical Center had a habit of making examples out of people. Dr. Vincent Cale had been doing it for 11 years. He would identify someone quiet, someone who didn't fight back, didn't complain, didn't have allies in the right offices, and he would put them in a position designed to fail. Not cruelly, not obviously, just precisely. He had a talent for it. On the morning of February 3rd, he chose Nadia Holt. Nadia Holt had worked the night shift in the Hargrove ER for 4 years. She wore the same blue scrubs every day, kept her dark hair pulled back in a low bun, and spoke only when spoken to. The interns thought she was slow. The senior residents thought she was forgettable. Dr. Cale thought she was the perfect candidate for a lesson. Not for her, but for the rest of the floor. He had noticed lately that some of the younger nurses were getting ideas about pushing back during rounds. One had filed a formal complaint about overtime hours. Another had questioned his triage priorities in front of a family. Dr. Cale didn't raise his voice at outside things. He made examples instead. That morning, he walked to the nurses' station at 7:14 a.m. and found Nadia completing her handoff notes with the same unhurried precision she applied to everything. "Holt." She looked up. "You're pulling a solo shift in Bay 4 through 6 this afternoon, 12 to 6. She didn't flinch. "That's 3 bays. I know what it is, doctor." "Cale, standard coverage is 2 nurses minimum per bay cluster. We're short-staffed." He said it the way people say things they know aren't true but can't be disproven quickly. "You'll have Dex on tech support. That's it." Dex Pruitt was 22 years old, 6 weeks out of a community college medical assisting program, and had the focused panic of someone who had recently learned that real emergencies look nothing like the ones in textbooks. Nadia looked at Dr. Cale for a moment, not challenging, not afraid, just measuring. "Understood," she said. Dr. Cale walked away. Behind him, at the corner of the station, charge nurse Bonnie Keyes watched the exchange with her arms crossed and her jaw tight. Bonnie had been at Hargrove for 19 years. She recognized what had just happened. She also knew better than to say so out loud. She waited until Dr. Cale rounded the corner, then leaned toward Nadia. "You don't have to take that shift. I can file a coverage dispute." "It's fine, Bonnie. It's not fine. He's setting you up." Nadia capped her pen and set it down on the notepad with a small, deliberate click. "I know," she said, and that was all she said. What Dr. Vincent Cale did not know about Nadia Holt, what almost no one at Hargrove knew, was that before she became a nurse, she had been something else entirely. Her full name was Nadia Reeve Holt, and for 6 years before her nursing license, she had been a flight medic with the 160th Special Operations Aviation Regiment, the Night Stalkers. She had flown into places that didn't appear on civilian maps and treated wounds in conditions that no hospital administrator could picture from behind a desk. She had her certification at 24 and her combat patch at 25. She had a call sign, Sparrow, given to her by her crew because she was small and quiet, and because, as her crew chief once told her, sparrows were the last thing you heard before you realized something had gone wrong. She left the military after her second deployment for reasons she didn't discuss with people at Hargrove. She passed her NCLEX. She took a hospital job in a mid-sized city in Ohio where nobody knew her name and nobody would ask questions. She wore blue scrubs and kept her hair back and let people think whatever they wanted. She had never once corrected anyone's low opinion of her. This afternoon, she thought, she probably wouldn't need to. The first call came in at 12:41 p.m. A highway pileup on Route 9 West, 3 miles out. Multiple vehicles. Mass casualty protocol initiated. Hargrove was the closest Level 2 trauma center. Dex Pruitt appeared at the bay entrance with a face the color of old paper. "They're saying," he checked his phone. "They're saying 7 incoming, maybe 8. Nadia was already pulling the trauma cart. "Get the second cart from Bay 5. Unlock the hemostatic supply cabinet. Code is 77 Sudfrance. Grab 2 large bore IV kits, 2 chest seal packs, and a Turnastage. Okay. 7 incoming. Dex." Her voice was even, not loud, just clear the way a radio signal is clear when there's no interference. 7 people need help. I need you present. Can you do that?" He swallowed, nodded. "Good. Go," he went. She moved through the bays the way she had moved through the inside of a Black Hawk at altitude. Not quickly, not dramatically, but with the quiet efficiency of someone who had learned that panic costs you seconds you don't have. She checked the oxygen lines. She checked the defibrillator charge. She moved the blood pressure cuffs to the outside hooks where they'd be accessible left-handed, which was how she worked when she was moving fast. She adjusted the lighting in Bay 6, where the angle would make IV placement harder. Bonnie appeared in the doorway. "I heard, I'm coming in, you're off rotation, Bonnie. I don't care, I have Dex, we're covered, go home." Bonnie stared at her. "Nadia, I'll call if I need you. She said it without looking up. I won't need you. Bonnie stood there for 3 more seconds. Then slowly she left. The first ambulance arrived at 12:58 p.m. The patient was a man in his 50s, construction worker, 2 broken ribs, lacerated forearm, BP holding. Nadia had him assessed, IV in, chest taped, and handed off to secondary imaging in 9 minutes. The second and third arrived together at 1:06. A teenage girl with a head lack and possible C-spine involvement, and a middle-aged woman with a left tib fracture and blood pressure dropping. Nadia triaged them in the ambulance bay before the gurney wheels touched the floor. A habit from the field, where you made decisions before you had all the information, because all the information was a luxury you never had. She called out to Dex without turning around. The girl is priority 2. Spinal precautions, no movement, monitor her airway. The woman is priority 1. Get me a second line, left AC, left OK, antecubital. Inside of the elbow. You've done this. I've done this on a practice arm. Same arm, different person. You've done this. He found the vein on the second try. Nadia didn't praise him and she didn't criticize him, she simply moved. The fourth patient arrived at 1:19. 60-year-old male, airbag deployment, significant facial trauma, airway concern. She managed his airway manually while Dex held the patient's head and she spoke to the patient in a low, continuous stream. Not reassurances exactly, more like a navigator reading coordinates, something for the patient's brain to follow instead of the fear. The fifth and sixth came in at 1:31. A young couple, early 20s. The man had a pneumothorax. She could hear it before the ambulance crew finished their handoff, the absent breath sounds on the left side. The woman had a fractured pelvis and was going in and out. Needle decompression, she said to no one in particular, because Dex was occupied and there was no one else. She did it herself, second intercostal space, midclavicular line, the movement practiced and automatic, and she felt the release, the hiss of trapped air, and the patient's color began to change back toward something human. She was managing the woman's pelvis, binder in place, fluid running, when she heard the doors. The 7th patient, she was small, 7 years old, maybe 8. Her name, the paramedic said, was Ivy Connors. She had been in the back seat of her mother's car when a pickup ran the light at the Route 9 junction. Her mother was in surgery at St. Matthew's across town. Ivy had a lacerated scalp. Head wounds bleed like they're angry, a probable broken wrist, and the particular stillness of a child who had been through something that broke the volume knob on the world. She wasn't crying. She was holding a small stuffed rabbit, gray and worn at the ears, and she was looking at the ceiling of Bay 4 with the focused attention of someone trying to be somewhere else. Nadia came to her side. She crouched down so their eyes were level. "Hey, Ivy." The girl's eyes moved to her, very slowly. "My name is Nadia. I'm going to take care of you today. Is that okay?" Ivy didn't answer, but she didn't look away either. Nadia did her assessment the same way she did everything. Efficiently, but without urgency in her hands, which was a different thing from urgency in her mind. She checked the scalp, applied pressure, checked the pupils, examined the wrist, kept talking. "That rabbit's got a good face," she said. "What's his name?" Silence. "You don't have to tell me." She wrapped the wrist in a splint, gentle. "I had a stuffed dog when I was little. Named him Captain. I thought that was a very serious name." Ivy's eyes tracked to the rabbit, then back to Nadia. "Button," she said. Her voice was barely there. "Button." Nadia nodded seriously. "That's a better name than Captain." Something shifted in the girl's face. Not a smile, not quite, but a loosening around the eyes. The particular release of a child who has decided cautiously that they are in a safe place. Nadia finished the wrist wrap and stood. "Button can stay with you the whole time," she said. "I'm going to step right over there. I'll be where you can see me, okay?" Ivy nodded. At 2:04 p.m., Dr. Vincent Cale appeared in the bay doorway. He had come to check on the damage. That was the honest description of it. He expected to find chaos. Patients inadequately managed. Enough of a mess to justify a formal review and a quiet reassignment. It was what the situation had been designed to produce. What he found instead was this: Patient 1, stable, in imaging. Patients 2 and 3, monitored and managed, awaiting specialist consult. Patient 4, airway secured, vitals holding. Patients 5 and 6, both stabilized. The pneumothorax patient, who should have been the most acute crisis of the afternoon, already breathing with something approaching ease. And patient 7, a small girl in Bay 4, holding a gray rabbit, watching a nurse who was charting quietly at the workstation beside her, close enough to be seen. Dr. Cale stood in the doorway for a moment. His expression didn't change because he had practiced that. But something behind it did. He turned to leave. "Dr. Cale." He stopped. Nadia didn't look up from the chart. Her pen continued moving. 7 patients, she said. 93 minutes. No adverse events. I'll have the documentation complete by the end of shift. A pause. "You can let Dr. Harmon know. She asked me earlier if we'd need backup." He left without responding. What happened next was not dramatic in the way that people imagine justice usually is. There was no confrontation. No announcement. No scene in a conference room. What happened was that Dex Pruitt, 22 years old, 6 weeks out of school, hands still shaking slightly from adrenaline, went to the break room at 3:15 and told 3 colleagues what he had witnessed. The way she had triaged in the ambulance bay, the needle decompression, the way she had talked to Ivy Connors while simultaneously managing a pelvis fracture 6 feet away. One of those colleagues told someone else. That person told someone at the charge desk. By the time Bonnie Keys came in for the evening shift, she had already received 2 text messages about it. By Thursday, the story had reached Dr. Harmon, Dr. Ellen Harmon, the hospital's CMO, through 4 separate people, none of whom had been in the bays that afternoon, but all of whom had received enough detail to fill in the picture clearly. Dr. Harmon made a phone call to the 160th SOAR Veterans Registry contact she had. She had 2 former military staff and had always maintained the connection. She made 1 inquiry. She got 1 answer. She sat with that answer for a long moment before she set down the phone. Then she walked to the ER. She found Nadia at the end of shift, Bay 4, doing her final check on Ivy Connors before the girl was moved to pediatric observation. The child's aunt had arrived. A woman named Grace Connors, somewhere in her 40s, who had driven 90 minutes from Columbus and arrived with red eyes and shaking hands, and who was now sitting in the chair beside Ivy's bed, holding the gray rabbit that Ivy had allowed her to hold, which said something about the aunt's standing in the girl's life. Nadia was explaining the wrist splint to Grace in the same unhurried way she explained everything. Dr. Harmon waited at the door. When Nadia finished and turned, she found the CMO standing there with an expression that was not quite an apology and not quite admiration. Something in between, the expression of a person reassessing a situation they should have been watching more carefully. "Can I have a few minutes?" Dr. Harmon said. Nadia looked at her. Of course. They walked to the end of the corridor. The hospital sounds moved around them, the page system, the soft roll of a medication cart, someone's monitor in the far bay. Dr. Harmon said, "I looked into your background." Nadia said nothing. "I should have done it 4 years ago when you were hired. I didn't." A pause. "That's on me. I didn't advertise it," Nadia said. "I know. I'm not sure why you didn't." Nadia considered this. Outside the corridor window, the sky over Hargrove was the particular gray of late winter, the kind that made the hospital lights seem very bright and the world outside seem very far away. "I came here to be a nurse," she said finally. "Not a story." Dr. Harmon was quiet for a moment. "Well," she said, "you're going to be a harder person to ignore." Dr. Vincent Cale was not fired. People like Dr. Cale rarely are, not quickly, not cleanly. What happened was slower and more final. Dr. Harmon initiated a staffing practices review, officially routine, officially unrelated to any single incident, and the review, conducted by an outside consultant over 6 weeks, found a pattern of what the report termed inequitable workload distribution affecting a statistically significant subset of nursing staff, predominantly female, predominantly in the 40 and under age group, predominantly on the overnight and weekend rotations. Dr. Cale was reassigned to an administrative role with reduced clinical authority. He did not fight it. He had perhaps looked at the documentation that Nadia had completed by end of shift on February 3rd. 93 minutes, 7 patients, every chart clean and time-stamped, and understood quietly that there was nothing to fight. Dex Pruitt became a good ER tech. He wasn't graceful about it. He fumbled lines sometimes, got flustered during multiple patient arrivals, had to be reminded about left-handed access positioning more than once. But he showed up, he paid attention, and he had that afternoon in February been close enough to watch someone work at a level he had not known existed, which gave him a standard he was now trying to reach. He asked Nadia once, about 3 months later, what her call sign had meant. He had overheard something. Someone had said it in passing, some fragment of a conversation he hadn't been meant to catch. She looked at him for a moment. "Sparrow, what's that mean?" She thought about it. "It means small, it means quiet." She picked up a chart. "It means you hear one right before something changes." He nodded slowly. He didn't ask anything else. Ivy Connors was discharged 4 days after the pileup. Her wrist was set, her scalp stitched, her color back. On the morning of her discharge, she asked her Aunt Grace if she could go say goodbye to the nurse. Grace said yes. They walked down to the ER, which was busy that morning. A Thursday, the kind of day that was always unexpectedly heavy, and Ivy stood at the edge of the bay entrance and waited with the patience of a child who has learned that some people are worth waiting for. When Nadia came out, she crouched down again. Same level, same steadiness. "You're going home," she said. Ivy nodded. She was holding Button against her chest. "Wrist okay?" "It itches, that means it's healing." Nadia smiled, a small but real. "That's the good kind of itch." Ivy looked at her for a moment with the direct, unfiltered appraisal that children apply to things they are trying to understand. "Were you scared?" she asked. "That day, when all those people came." Nadia considered the question with the same seriousness it was offered. "A little," she said. "At the start, what did you do?" "I remembered what I was there for." She touched the girl's uninjured wrist lightly, the way you touch something you want to be careful with. That usually helps. Ivy thought about this. Then she held out Button. Nadia looked at the rabbit, then at the girl. "I can't take Button," she said. Button is yours. I know, Ivy said. I just wanted you to hold him for a second. Nadia took the rabbit. He was soft and slightly lopsided and smelled like a child's bedroom. She held him carefully, the way she held things she knew mattered, and then she handed him back. Thank you, she said. Ivy tucked him back against her chest and walked back to her aunt. Nadia watched them go down the corridor. The small girl in the blue hospital socks, the aunt's hand on her shoulder, Button's gray ear sticking out from under Ivy's arm, and then she turned back toward the bays, where someone was already waiting, and the work, as it always did, continued. That's our story for today. Thank you for spending time with Nadia and Ivy and everyone at Hargrove Regional. If this one stayed with you, if you found yourself thinking about the people who show up quietly and just do the work, leave a comment. I read every single one. Tell me where you're listening from. And if you're new here, welcome. There are a lot more stories where this one came from. Subscribe so you don't miss the next one. Take care of yourselves. I'll see you soon.